Are vaccines safe for kids? What are the side effects? And do young kids even need the COVID-19 vaccine? Hi there. Thanks for joining us for another edition of Ask the Experts Live. My name is Sean McMahon, Manager of Communications and Media Relations for CIUS West Central Montreal and host of the Your Health podcast. Tonight, it's all about COVID-19 vaccines for 5 to 11-year-olds, which is well underway in our CIUS and across the province for that matter. Thanks for joining us for this interactive Facebook Live event. So great to have you. Now, usually we chat with one of the experts from our CIUS. This time, we're joined by one of our friends over at the Montreal Children's Hospital, pediatric infectious disease specialist, Dr. Earl Rubin. Dr. Rubin, great to see you. How are you?
I'm good. How are you, Sean?
Doing well, thanks. This is fun. This is like one of those crossover episodes on your favorite sitcom when one of your favorite stars goes on the other TV show. It's nice to have you. By the way, this event will be in English. I would like to remind you that we also had a chat with your colleague, Dr. Jessie Papenburg, in French. If you just missed it, you can check it out on demand in the video section on our Facebook page. We are also taking your questions live in the comments section. So if you've got a question, feel free to drop it in the comments section, and we'll try to get to as many as we can in the short amount of time that we've got tonight. And let's dive right in, though, Dr. Rubin, with maybe the simplest question of all, frankly, but it's the one that's probably the most important for every parent, the one that they care the most about. Are these vaccines actually safe for kids?
So, Sean, I don't think any question related to COVID is simple. I think that we are learning each and every day. But to answer your question very briefly, and then I can give you the reasons why, everything that we know to date is that it is extremely safe for children. Before getting approved by Health Canada and by the FDA in the States, there were over 3,000 children, the 5 to 11-year-olds that we're talking about, who were evaluated. And in their follow-up period, there were no significant adverse reactions. There was the local reactions, a sore arm, swollen, maybe some malaise, maybe a little bit of fever, that all short-lived. And nothing significant. But what is much more telling is that since it got approved in the States, there's over 4 million kids aged 5 to 11 who have been vaccinated.
Wow.
And there are no significant signals of adverse events. This is all following the first dose. We will see what happens following the second dose.
So on that note, when you talk about serious adverse events, we did get a question from Kirill, who was asking more about the serious side effects possible with the vaccine. Things like myocarditis, for example. We've heard that talked about. People are concerned about those types of things, but that doesn't seem to really be a real concern at this point so far, with all that we've seen and the sample size that we have available to us, right?
So that's a great question, whoever asked it. The myocarditis is an issue that we are concerned about, but it is something that we see predominantly in young adult males, 18 to 30. In that pre-marketing studies that I told you about, there were no myocarditis events in the 3,000 people. The myocarditis that we do see in those who got it, in the adults or the adolescents who did get it, it is rare, but it almost uniformly happens after the second dose. So in the 3,000 kids who got evaluated pre-marketing, we didn't see it at all. In the 4 million kids in the States, only a small percentage of them have received the second dose. And it is generally within the first week of the second dose. So to date, there has not been a high number that have been reported, but I can't swear to that there have been no reports, but nothing that has come across my eyes, either in preprint or any warnings that have been sent out. So myocarditis is something that we are watching. It is generally after the second dose. It is generally in young adult males, and it is also generally relatively mild. It can give you some chest pain, some shortness of breath, some feeling of palpitations. Most go away on their own or with anti-inflammatories like Advil. But it is something that we're watching, but nothing to date that we're concerned about.
I appreciate that. And again, if you have any questions, feel free to drop them in the comments on our Facebook Live. The goal of tonight's event is not to convince anybody to do anything. It's really just to inform. But there are, those with hesitations, concerns, lots of questions. Rachel Iona wants to know if all the vaccines, she says, were recently considered safe, and then AstraZeneca was found to be problematic. Then the Moderna was found to be problematic for young people. How can anybody possibly say that this time Pfizer is safe? If you want to tackle that.
Yeah. So the AstraZeneca, I think that you have to look at, they're still overall very safe. The viral vector vaccines. There was that increased incidence in VIT, or those thromboses, that were seen and were being followed and were being reported, but it happened rarely. We have not really rolled out very much of the AstraZeneca in Canada. There was some, but absolutely none in children, not 5 to 11, nor in adolescents. So that's in terms of the viral vector vaccine. In terms of the Moderna, the only issue with Moderna was a slight increased incidence of myocarditis compared to Pfizer post the second dose within the week, but still exceedingly rare. So the incidence for Pfizer was about 8 cases per million of the second dose, which gave an incidence of 0.009%. And for Moderna, it was 28 per million, which gives an incidence of 0.003%. So yes, it is much higher than Pfizer, 3 times, let's say, but still incredibly rare. So, and then in terms of, is it safe for Pfizer, to come back to Rachel's question, we heard about AstraZeneca and we heard about Moderna. For Pfizer to date, there really has not been any significant signal. For sure, a significant proportion get a sore arm, maybe even a little bit of swelling, some malaise, maybe some low-grade fever. The amount of messenger RNA in the pediatric formulation is only 1/3 of what is given to adolescents and adults.
Okay, so that's the difference in the dose. It's 1/3 of the dose that you and I have received, basically.
So it's 10 micrograms of the messenger RNA versus 30 micrograms.
Okay.
And that the reports are of those expected side effects or reactions that you have in the first 24 to 48 hours seem to be even milder compared to adolescents and adults, probably related to the smaller amount of messenger RNA.
Getting lots of great questions on our Facebook page, and a lot of them have to do with safety. We have one from Peter here. Specifically, he asks if it's safe for a child of 8 years of age who just got diagnosed with juvenile arthritis to take the COVID-19 vaccine. So an example of, there's a condition, is it still okay to go get vaccinated? What would you tell Peter and maybe anybody else in a similar situation to Peter?
Yeah, so you have to look at what the illness is, when that illness was diagnosed, and what that illness is being treated with. So if we're going to, for Peter's question, if you say for juvenile arthritis, are they on an immune suppressing drug, whether it be steroids or a biologic monoclonal to help for the JIA, that puts that child, or any person for that matter, at increased risk of complications from COVID. So it's even more important that they get vaccinated. If it was just a recent diagnosis, like he's saying, I would say that to discuss it with the rheumatologist or the physicians that are treating them, because if it's still being worked up and is evolving, they may not want something that may complicate the picture in terms of what's going on. But if it's a well-established diagnosis, there is no contraindication. I would encourage people to speak to their treating physicians for whatever illness that may be, but there really are no clear contraindications to giving the COVID vaccine.
Okay, and if you're looking for more info, by the way, if you're just joining us and looking for info on where to get vaccinated, what the eligibility criteria is to get vaccinated, you can check out our website, CEUSwestcentral.ca, CEUSwestcentral.ca /COVID vaccination. Great page, lots of resources on there, interactive map. You've got the opening hours at our mass vaccination sites and any info that would help you make the right decision. And then, of course, lots of links on there as well to get more info on this as it pertains to, in this case, your 5 to 11-year-old. And we appreciate Dr. Earl Rubin, a pediatric infectious disease specialist from the Montreal Children's Hospital, joining us for this interactive Facebook Live event tonight. Dr. Rubin, a question from Heidi on our Facebook page. Heidi Rude, thanks for watching. How can parents make an accurate risk-benefit comparison, especially since hospitalizations and deaths in this age group are so low, less than the flu, she points out, she says.
So Heidi, that's a great question and a very common question that we get. And so what Heidi is saying is that we know that COVID is relatively benign in children, and people are more afraid of the unknown associated with a relatively new vaccine, although there have been billions of people to date who have received the vaccine. Although COVID is relatively benign, and we keep our fingers crossed and we pray that it stays that way, there are still kids who get sick from COVID, besides the fever and the malaise, etc. The hospitalization rate in children, if infected, is under 1%. It's about 0.3%. So that's 3 per thousand. It's not nothing. The death rate is 0.002% if infected. So it's rare, but across Canada, there have been some pediatric deaths. So that does happen. But what is much more concerning is the post-COVID inflammatory syndromes. They're called PIMS or MISC, so a multi-system inflammatory syndrome in children. That's the MIS-C, or PIMS is a polysystem inflammatory syndrome in children. And that, if infected, if it does happen, those kids end up in the intensive care unit for the most part. They are quite sick. They uniformly survive, but with intensive support, requiring medications to keep their blood pressure up, requiring an ICU stay. And that happens overall in about, of those who are infected with COVID, anywhere between 0.5 and 5% of the active. And that generally presents about 2 to 6 weeks, maybe up to 8 weeks after the infection. The overwhelming majority of those don't even know they had COVID, or they'll say they had a little bit of something, but it really wasn't much. But they do become deathly ill. So, and then you look at what are the side effects of the vaccine, and you want to compare that to those numbers. And so we do not have PIMS or MISC post the vaccine. There's been one report where it was questioned. We do not have deaths that are related to the vaccine. We don't have hospitalization. And so that's for protecting your child, which I think most parents are asking about, because the next thing that we'll often say is, what about protecting the person around your children? Right. So people who are they're most interested in are themselves or the grandparents or the extended family. And right now in Quebec, and across Canada for that matter, more than 25% of all the positive COVID cases are in school-age children, and the overwhelming majority are in the 5 to 11-year-olds. Coupled with the fact that many of the grandparents and parents, it's been close to 6 months, if not longer than 6 months, since they received their second vaccine. So we would say, yes, the parents or grandparents are protected with the vaccine, but there is waning immunity. And so the next reason besides the child getting sick is we want to protect their immediate and extended family, and they are susceptible because of waning immunity. And then you go to the next level where a lot of parents say, well, I don't really care about that. But for the society as a whole, we want to decrease the ongoing propagation. And so the outbreaks are related to schools. The transmission that we're seeing in the doubly vaccinated are in household contacts of school-age children who are positive. And then the last thing is we want kids, all of us for that matter, to live life as normally as possible.
And just get back to being kids, right? I mean, I got two of my own, and just to get back to being kids.
Exactly. We don't want to keep them home from school, online, away from their friends, not taking part in activities, and all of these are all the reasons. So people are most interested in their own children, but they're also interested in themselves and their loved ones. But it does have that impact on the society and on the enjoyment of life for everybody.
I think that's really interesting because you're right. When we talk about the benefits of vaccination, it really does go beyond just the one individual, the child in question. We protect them. You want to protect your kids, but it goes to those outer layers. I mean, it really is like an onion. You're protecting your family and your family setting, that circle, and then it's school and it's sports. And seeing as how you brought up school, let me take you down that path for a second. If we are now starting this vaccination campaign for the 5 to 11-year-olds, there's very much still outbreaks in schools and cases in schools and schools closing and classes closing. As we go, if you can just extrapolate, read your tea leaves, look at your crystal ball, a few weeks down the road, are we going to hopefully see a diminishment of some of that we've been experiencing for many, many months now after the first, and then the second dose is administered to more and more and more kids in this age category in particular?
Yeah, so that's a great question, Sean. So crystal ball, and actually even looking in a retrospectoscope, once there is the break from school and the kids are off for the Christmas holidays for 2 weeks, last year we saw a decrease in the number of cases in children, only to resurge after the kids came back. So if that short-term crystal ball, maybe there will be a decrease. However, during that time, the kids are going to still socialize and see their family and have Christmas parties or Christmas get-togethers, hopefully with less than 20 people. That will allow that ongoing propagation, but hopefully the people around them will be doubly vaccinated and not getting that sick should they get infected. The other thing that hopefully will decrease is the rollout of the vaccination program. Before Delta, we knew that one dose of the Pfizer vaccine was very protective in the short term, close to 90% to prevent infection. With Delta, on the other hand, it's still one dose because it's only being rolled out, and we want at least an 8-week interval between the two doses. So most kids, because it hasn't yet been 8 weeks, will have only received one dose. So there'll be some partial protection, and hopefully that will have an impact. And then a greater impact once the second dose is rolled out. So the distancing during Christmas holidays hopefully will help. The first dose of the vaccine, if they get it, hopefully will help. And then we have Omicron to face. And
well, that's you led me there. And let me ask you about that, because we had a chat, I don't know, about a week ago, maybe 7 to 10 days ago, and we talked about Omicron, right? The new variant. At the time, it was probably still a little bit too early to tell. 7 to 10 days later, do we have any more information? Are we any more confident in terms of how the vaccine will protect our children, ourselves, but our children as well in this age? And do we know anything more than we did, say, a week ago?
I think we know more than a week ago, but we still don't know enough. Okay. And I think every day and every week we will know more. We are looking, because it is not dominant here, we don't have that personal experience, nor does the world have that much experience, because it was only first described in South Africa in the week of November 20th or so, but probably in Nigeria a week or two before that. So from South Africa, it seems that the illness is a little bit milder. However, the majority of people who are infected are young people, and young people don't tend to get that sick. But even outside of South Africa, it seems that at minimum it is not more severe than Delta, although Delta can be severe. It seems to be a little bit milder. That's in terms of severity. What we do know, which seems quite evident, is that it seems more transmissible. Delta itself, as we went from the ancestral strain to Alpha, it was more transmissible, to Beta. Delta was even the most transmissible, where it was possible that one person can infect 8 other people around them who are not immune. And it seems that Omicron may even be more transmissible than Delta. So that will increase numbers. So our hope is that the vaccine will offer protection. We do not have a sufficient data. They are growing the virus and taking people's serum and trying to neutralize and see, does the antibodies and everything else that's in our blood post-vaccine protect against infection or serious disease? And so we're still waiting on that data. There was some worrisome comment by the CEO of Moderna that he said it didn't look hopeful. Followed by a statement from Pfizer that they said it does look hopeful, but with 3 doses. Mm-hmm. But all of this has not yet been published, is not yet been validated, peer-reviewed, and hoping in the next 1 to 3 weeks, we will have more information. And
it really is. It's about time, right? I mean, I keep thinking back to when all of this first started, and all these conversations were around this. We just don't know enough right now. We don't know. We just don't know because it's brand new. But we've learned so much since then, and all those things that we've learned are all being applied in, I think, a really positive way. And I get the sense that this has the same arc to it, that we'll eventually learn more the further it goes along, and then eventually we'll be able to apply that information, that data to the process.
I have to tell you something, Sean. We've been asked, as the ID specialists, questions from the beginning. And my first answer before I provide an answer is whatever I told you last week may be different than I'm telling you today, right, and almost certainly will be different than what I'll tell you next week. And so we are learning as we go. Are we the experts? We are somewhat immersed dealing with this day in and day out, but it's not like we have years of experience under our belt to say this is what's going to happen. And certainly with the evolution of new variants, we don't know, and we are learning as we go.
It's interesting, victim of unpredictability, I suppose, but it's interesting. We have just a few minutes left, a couple of last questions. And if you're just joining us, hey, thanks so much for being here for this interactive Facebook Live event. If you like this kind of content, I invite you to follow us on all of our major social media platforms. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube. Just search for CIUS Centre West. That's CIUSSS Centre West. Last couple of things. What do you tell a parent, Dr. Rubin, who maybe feels the vaccine was rushed, and maybe that's the reason why they don't feel comfortable having their kids get this vaccine?
Yeah, so that we hear often that, I'm not going to trust this because it was rushed. It wasn't more rushed. It was rushed because of the urgency to have a vaccine that was effective come to market. But it still went through all the steps of phase 1, 2, 3 trials with vetting and reviewing of the data. It was rushed because there was the need to get it out. Mm-hmm. However, vaccination started December 2020. And so here we are, a year later. And there you very rarely have vaccine data with billions of people in such a short period of time.
How true.
That is telling us, what are the signals? What are the concerns? What can happen and how commonly, and what do you do? And overall, we can get into details, but we don't have the time. But overall, it's a very safe vaccine, and it really has had a huge impact. We see it, although the numbers in Quebec are going up. Our hospitalizations, thankfully, and I don't want to jinx it or talk too soon, we're not seeing that surge of hospitals being filled and ICUs being filled. And that's thanks to the vaccine.
And with this 5 to 11 group specifically, is this the missing piece, to the pandemic? Is this the final piece to the puzzle of putting it all together and really getting as many people vaccinated and having an adequate level of protection as possible? Is this the piece that's been missing?
It's certainly a piece. It is not the final piece. There's nothing final about this.
Fair enough.
Overall, the world, certain places in Africa, they're very low vaccination rates. Are we going to hope to get rid of this? I don't think that that's going to be possible without a universal, across the world, effective vaccine. I think our hope is that it will evolve either with the vaccines or the mutations themselves, not to cause severe illness, to cause hospitalizations, and certainly not deaths. Will it become a virus that is around, that we control with vaccination and control disease like influenza, like you said? All of that, left to see. But certainly, to answer your question, Sean, the 5 to 11-year-olds recently with Delta are the driving force for the increasing numbers. And that is what is going on the here and now. And that by having these kids immune, and then hopefully eventually the 6-month-old to 5-year-olds, by having everybody vaccinated and immune, our hope is that we won't see that much, and what we do see will be mild.
Not only questions, but comments on our Facebook page as well. This one from Heather. She says, thank you, Dr. Rubin, for always sharing your voice of reason and incredible knowledge. And there's an exclamation mark in there. So thank you.
Thanks, Heather.
I echo that. 2 last quick ones for you. How do you suggest parents can better prepare their kids for vaccination, which frankly can be a little bit scary? I know my kids were a little bit scared going in. They felt great after. They had a bit of a sore arm, but it was, it's a lot of people. There's a lot going on. It's a process, and they were pretty tense about it. How do you prepare a parent for this, and what can they do to maybe ease some of that, bring the temperature down a little bit?
Yeah. So vaccinations are not new to children. Most are younger. There is a whole series of vaccines, but some are done in grade 1 or 2, then in grade 4, and then in grade 9. There's nothing different about preparing the kids for this vaccine than those vaccines. I don't think anybody likes a needle in their muscle, in their arm. Nobody.
No, I don't.
It's impressive. There's a lot of kids who are excited about getting the vaccine with the hope that it will make their life more normal. And I can tell you that my kids, it's like they couldn't wait to get it.
Oh, same here.
They're older, they're teenagers, but nobody likes it, that needle. And when I say, okay, it's time for your flu shot, in the past, even when they were young, it was like, do I need to? So I think that there is a huge benefit, and I think the kids know that. They've been very good in the vaccination centers in Quebec, distracting the kids and having child life workers there.
They've been amazing. They've been really, really amazing. I mean, having seen it with my own eyes, amazing. The person who vaccinated our children, I think she said, I think I've done about 3,000 at this point, and took every moment needed to make sure that it was the right time to do it. And I mean, I just tip of the cap to everybody who's worked really hard to get ready for that, and also making it a lot easier for the little ones. My littlest, she was, when I told her we made the appointment for the vaccine, she said, "Oh, we're famous." So I love her spirit. She was really excited about it. So I'm glad for that. Last one, just because, as you said, holiday season, gatherings inevitably will happen, hopefully in the allowable groups. Got to be careful. Just some tips, some advice maybe for a safe holiday season for everyone, keeping families safe, knowing that, yes, vaccination is here, but like you said, it's not the be all end all solution to things. So what can we do?
Yeah. So I think that we have to use our judgment. For whatever reason, and I understand the reason that Quebec said we're going to go from 10 to 20 people for gatherings because people need it and want it. However, with the increasing numbers, it's concerning. And so what I would say is really use your judgment. If there's somebody who's not vaccinated, so now forget about the kids who are not vaccine eligible. If you have adults who are not vaccinated, if you have adults who are vaccinated or not, who are immune compromised, if you have elderly parents and grandparents who are going to be part of it, who we know can get more severe disease, I think either that you don't have 20 people and you limit it. Try and either not have them if you have unvaccinated or non-vaccine eligible kids who are there who will just finish school, but can't be, can't say bah humbug and be Scrooge and say you can't do anything. But I think that we need to really use our judgment. And if you are indoors, I would encourage people to keep a window open to help air circulation. If there's kids who are not vaccinated, maybe keep them distanced if possible from those who are more susceptible. Those who are susceptible, not pleasant, but maybe have them wear a mask except when they're eating, and then they can eat more separately. I think we just have to use our judgment to try and limit the spread. But probably most important and the most difficult is don't have somebody who has that, I just have a cold. My nose is running, my throat is sore, I have a headache, but I have a cold and I'm doubly vaccinated. And in the doubly vaccinated, it may just look like a cold.
Mm-hmm.
So it's probably best those who are symptomatic don't participate in that party. You don't even want colds being transmitted. Forget about COVID, because it starts that whole sequence of event. That next person catches the cold and they say, oh, I have to go for a COVID test. Can I go to my next party? Can I go back to work? So it's best to kind of keep people who are symptomatic apart.
I think that's all really, really great advice. Use your judgment, and of course, for the rest of us, just keep doing the things that we've been doing. Social distancing at every opportunity. Make sure you wash your hands and do all those things. Wear a mask when you can. They're all really important. We repeat them, but it's important. This has been. I know we went a couple minutes over, but I thought this was great. It went really, really quickly. And I can't thank you enough for the insight. Very important again. And I know Dr. Papenburg, your colleague, feels the same way. Reliable sources of information. If you need to look for some information, make sure it's reliable sources. You can start with our website, cuswestcentral.ca/COVID vaccination. If you're looking for the info on where to get vaccinated, how to get vaccinated, and the eligibility, and lots of other resources in our site too. Dr. Earl Rubin, pediatric infectious disease specialist from the Montreal Children's Hospital. Thank you so much for taking the time. I really, really appreciate it. And I know everybody does as well. So thank you so much.
It's my pleasure. Happy holidays, everybody, and make them safe holidays.
Absolutely. Happy holidays. And just in closing, a couple of quick little things. If you are a healthcare worker, by the way, I really want to mention this, looking for a new opportunity. There are lots of great opportunities to join us at CUS West Central Montreal on the team. Head to designyourcareer.ca or desintacarriere.ca to submit your CV, get started, join us, make a difference. Lots of great people doing really, really great things. And we'd hope to see you real soon. So on that note, yes, happy holidays, safe holidays, Dr. Rubin. We'll talk to you again real soon. Thanks so much, everybody. Thanks for all the comments and questions. This has been great. We'll talk to you soon. Good night.